Welcome. I'm Jan Marini, the founder of Jan Marini Skin Research. I am here with Sydney. Sydney's here for a consultation, and she is a full-time student at De Anza. But also you do something else when you're not in school. What else do you do?
I'm also a CrossFit trainer at RPM Fitness.
And she told me that she has been in CrossFit for like about a year or so. And you're kind of even thinking about maybe a fitness career.
Yeah, if I keep going at the trend I'm at, hopefully I can compete at a regionals or something like that.
Yeah, I like working out as well, so I'm interested in that. Actually, Sydney is the daughter of Kristen Johnson, and I met Kristen quite a while ago because she was a hair care rep and color rep for a hair care company at the salon that I go to. So that's how you got referred to me. So anyway, here we are today. I'm going to ask you some questions. If there was something you could change or improve about your skin, what would it be?
It would probably be the hyperpigmentation in my skin. I notice I get a lot of discoloration just like around this area, and it's just, you don't feel as confident when your skin's totally different colors, and I think that just kind of affects my mood sometimes.
Okay. What else would you like to change or improve?
The acne, I guess, would be like the source of the hyperpigmentation, so I guess fix the acne, then the hyperpigmentation would come along with it.
Okay. Anything else?
Sometimes I feel like I have big pores.
Okay. Anything else?
I think that's about it, unless you have any suggestions.
Okay. Well, let me ask you, now have you ever been a smoker?
No.
Okay. And sunbather?
No.
Okay. So tell me what skin type you think you have. Do you think are you more dry, normal, oily? How
I feel like it's a mixture because sometimes I get really oily like in my T-spot, but then I notice that like my chin gets dry, or I'll get random spots of dryness on my cheeks. It really just depends on the weather, I think.
Okay, so would you say kind of your skin is kind of combination, like in other words, your T-zone generally tends to be on the oily side. Does it get really oily and shiny, or does it just kind of, do you have to blot it a lot, or just a little bit?
It gets pretty shiny, and I'll notice it, but I don't know if I've really ever blotted it. I'm not the best with like makeup and stuff, so I don't really know what other people do, but I have just like, if I notice it's super oily, sometimes I'll just wash my face if it's after a workout or something. But yeah, I noticed that this area specifically gets oily.
Okay. So tell me, let's talk a little bit about the acne. And where do you typically tend to break out most?
I think it's mostly in like my chin and like my mouth area. I get a lot of blackheads like on my nose. Sometimes I get the underground zits, which are super painful. Every once in a while I'll get like kind of like a backup like up here. I normally don't get them on my cheeks, but sometimes I'll get them like right here. Every once in a while I'll get like a random one on the side, but I would say it's mostly here.
Okay.
Yeah.
So do you normally get red bumps that turn into pustules, or do you get, like you said, those sort of underground, the larger nodules or cysts?
I get both.
Okay.
Yeah.
So how old were you when the acne started?
I think as long as I can remember, really. Middle school, probably
11, 12 maybe?
Yeah, somewhere around that.
Have you seen a dermatologist?
I have seen some dermatologists in the past, yeah.
What did they do for it?
I've been given a sulfa cleanse, and it seemed to work a little bit, but it never really solved the problem. I think that's pretty much it that I've been given.
So no antibiotics or nothing
No,
like
I've never
that?
taken an antibiotic for it. Yeah.
Okay. What do you do that you think makes your acne better sometimes, or what do you do that you think makes it worse?
I think when I limit my sugar intake, I notice my skin is a little bit better and it doesn't get as red. If I'm eating more dairy than usual, I notice I might get more flare-ups, and I try to limit my dairy. I try to not touch my face, especially when I'm working out and my hands can get dirty. And just washing it after working out. I think I notice a difference.
Okay. Anything that you do topically that you think makes it better or worse?
I've used like little tiny like pimple reduce things, but I don't think that they really work.
Okay. Okay, we'll talk more about that. So I want to focus a minute on what you said about your diet, because this is really interesting. Now, diet doesn't necessarily cause acne. Like, in other words, if you have a really great diet, you're never going to have acne, and if you have a really lousy diet, you're going to have bad acne. Because I bet I know people that we look at their skin and we go, how can their skin look so good, and they
eat like
exactly. Or they don't get enough rest. They do all the things they're not supposed to do. Plus smoking, and they still have good looking skin, at least when they're young. So there is a correlation on a couple of levels between diet and acne, and you kind of hit on it. Okay, so one is that it has been proven, and this was a study that was printed in the American Journal of Dermatology, that milk causes acne, or at least that it can exacerbate it. Now, a lot of times we think, oh, it's because we give hormones to cows. No, it's because we keep cows pregnant the entire time we milk them to keep the herds up. And so in nature, you all watching have heard me say this before, but in nature, if a pregnant cow is nursing a calf, they'll push the calf away as soon as they get pregnant. So when you go into a supermarket, whether it's Whole Foods, whether it's organic milk, wherever it is, and you're getting milk, if you had it tested, it has all these steroidal hormones in it. And they actually did the study on 47,000 nurses. Then they repeated the study on the nurses' sons and daughters, and they've also done a couple of other studies on teenage boys and teenage girls. So we definitely know, and for some people it can be worse than for other people. So for you, it could be a real trigger. The second thing that we know can play a role in acne, and there's research being done on this, but a lot of derms feel strongly about this, and that is having to do with the glycemic index and the glycemic load. Now, if you work out, you probably know about that. So the glycemic index is just a number that you would assign to something. Like, obviously, a candy bar would have a high glycemic number, but the glycemic load is a little different, because you could have something that doesn't appear to be, like, say, a slice of whole wheat bread, and you go, oh, it's the best whole wheat bread you could possibly get, but it could actually, when you ingest it, have a higher glycemic load than a quarter cup of sugar. So what we found is that when you keep the carb level down and you keep that glycemic load down really low, there's less inflammation. Acne is an inflammatory disorder. But the other thing that happens with acne is that when you eat a lot of carbs, some people are more carb sensitive than others, but if your insulin levels are constantly going up, what happens is that you may produce more testosterone to take those levels down. So it's causing your acne. And lots of times we see it in this area. So in terms of that, if the most you can do consistently over time, it's not like it's just a miracle and all of a sudden you start eating differently and your acne just gets a lot better. But it can make a difference over time. It really can. It also makes a difference in terms of aging. Okay, so that's one thing that I think is really important. Now let's talk about what you use currently. So what do you wash in the morning with?
I've used just a Neutrogena all-in-one acne control wash. Just from Safeway. I've used a few different Neutrogena ones. I've used what's that other popular one you get in the mail?
Well, there's like Clean and Clear. There's a bunch of different, but generally what they have in them is they have salicylic acid. And salicylic acid is helpful because what it does is it goes after what's called the microcomedone. It's kind of the beginning of the acne process, but it's a large molecule, so it kind of needs help getting in the follicle. And it's not the only thing that we need to do for acne, but it's helpful. Then what do you do after the wash? Anything at all?
After I wash, I normally will put on a moisturizer, and if it's morning time, I'll normally put on a sunscreen or a tinted moisturizer of some sort.
So, the moisturizer that you might put on after you wash, do you remember what brand that is?
I think it's a CeraVe PM type.
Okay.
Yeah.
And actually, CeraVe is a pretty good brand. There shouldn't be anything in the CeraVe that aggravates your skin. It's not necessarily going to help your acne, but it shouldn't aggravate it. And then you say you like a sunscreen. So tell me about the sunscreen. What brand?
Recently I've been using a Mercier tinted moisturizer. If I'm going to be out in the sun a lot more, I'll use, I have no idea what it's called. It's just a sunscreen that my mom gets. And it's like in a bottle and you shake it. But it has a lot of SPF, and I'll use that, and I've never gotten burned from that. So,
the Laura Mercier, and by the way, Laura Mercier Tinted Moisturizer is probably one of the most popular products in the marketplace. And it's just a really, I mean, they call it a tinted moisturizer, but it's a very nice looking foundation.
Yeah.
Here's the problem. So I always joke with people and I say, okay, so if your sunscreen is in your foundation, do you put a really thick coat all over your whole face? Do you put it on your neck, over your ears, on your mouth, on your chest? Of course not. Nobody does. So you really have to use a sunscreen because you're just not going to get the same protection. And because they have redone the sunscreen monograph, most of your makeup products aren't going to have the same rating that they once had, and they just don't have the same ability to protect. So it's really important to wear sunscreen, but we'll get to that too. So then at night, do you wash with the same cleanser?
Yeah, I'll wash and use moisturizer. And
same thing?
Yeah.
Okay. And then do you do anything on an occasional basis? Like, do you ever use a scrub? Do you ever use a mask? Anything like that?
Yeah, I've used like a mask from, like, what's it called? Lush. Every once in a while.
It's like a clay mask?
Yeah, it's like an oatmeal mask.
Oh, okay,
yeah.
oatmeal.
But not typically.
So let me ask you another question. Do you ever flush and blush? Like, let's say that, well, you're not 21, so you don't drink. But let's say you eat really spicy food. Do you ever like turn red, or do you ever blush into your chest or neck area?
I do feel like I'll randomly get red, but I don't know if it's from. I don't really eat spicy foods, so I couldn't really answer off spicy foods. But I do feel like sometimes I get really red all of a sudden.
So I'll tell you the reason I asked that question. Sydney does have some redness in the cheek area, and that may be just as a result because she has some acne in that area, but also she may be showing signs of what we call vasomotor instability. So lots of times people that are predisposed to rosacea, that kind of disorder where you look red all the time, they start off with kind of pre-stage 1 rosacea, and they might be in their late teens, they might be in their 20s, but if they get upset, or they're laughing a lot, or somebody has a glass of wine or eats spicy food, then what they'll do is they'll flush and blush, and that flushing might last just a little bit of time, but it can also go down into the chest and the neck area. So they're showing signs of vasomotor instability. And if that's the case, then we want to do things that might help to prevent you from actually developing rosacea. So that's why I asked that question.
Yeah, sometimes I notice that other people's skin seem like so like fair and just neutral, and I feel like my skin is always like a little bit redder than everyone else's.
Okay, so that's a possibility because she's very fair skinned, and people that are fair skinned are more prone to that type of vasomotor instability. Okay, so the other thing is that you talked about your hyperpigmentation. So what happens in individuals when you have acne breakouts is that the inflammatory process, as it makes its way to the surface, one of the things it does is it releases sort of iron oxides. That's what gives blood its color. And you end up with what's called post-inflammatory hyperpigmentation. Now, if you've got a darker skin, an olive skin, they kind of get brownish, purplish. With a fairer skin, it tends to be more on the red side, although it can be somewhat purplish. And it's really distressing because it can take days, weeks, months to go away. And so that's what's really bothering you.
Yeah.
So you're absolutely right. If you don't break out, you don't get the hyperpigmentation or the post-inflammatory hyperpigmentation. But also we want to do things to kind of help that to go away faster. Okay? So let's talk about what we're going to do for you. And I'm also going to spend a moment and talk a little bit about the acne process. Now, you may already know this, but I really think it's helpful when you visualize how acne occurs, what the process is, because then you understand why what you're using is working and how important it is to be really consistent. Okay, so when you touch the outside of your skin, which we look at in the mirror, that's actually a dead layer. It's known as a stratum corneum, and you shed cells all the time. You shed about 500 million cells a day, but you're not aware of it. You've heard me say this before, the little tiny cells are microscopic. When you look at a follicle opening, because you mentioned, like you said something about, well, I have, some large follicles. And I always used to think of follicles as being like this big cavern because it must be huge inside, because it must be full of all kinds of gunk. But actually your follicle is only about as big around as the diameter of a hair. And it's lined with dead cells like on the outside of the skin. And at the bottom of the follicle, you have the sebaceous glands that produce the oil. So the follicle sheds cells just like the outside of your skin. One of the reasons you produce oil is the oil pushes the cells to the surface. They sit there and they fall off. That's what's supposed to happen. Now, in individuals that have acne, and by the way, I'm a 2-time Accutane failure. So I had severe cystic acne. I had perfect skin as a teenager. I was 19 when I started getting acne. So when you have acne, for some reason, these individuals, we don't know exactly why, your cells and your follicles stick together. That's the beginning of the process. Now, this could have started when you were 8 or 9 years old. And when you have microcomedones, you don't necessarily have anything on the outside of the skin. They just sit there and they're dormant. It's like one morning you wake up and all of a sudden you're starting to break out. So it can take actually weeks, days, months longer. Microcomedones can sit there and be dormant before you actually have something that you see on the surface of the skin. So it's this little tiny clump of dead cells. Now, if the dead cells collect and collect and collect, your follicle can actually dilate. You can see that as like a large pore.
Okay.
That's still acne, but it's the least serious form of acne. It's when you don't have that pore opening and you've got all of this material in the follicle that's collecting. Plus there's something called P. acne bacteria. Now, P. acne bacteria is harmless. I have it. Everyone has it on their skin. But when it's in that follicle and there's all of this material in the follicle that's sticking together, the bacteria loves that environment because there isn't as much oxygen. And so it flourishes, and what it does is it eats the oil. And it excretes a fatty acid byproduct. Now, this byproduct is very toxic and very corrosive, and what it does is it wears down your follicle wall. When it wears down to the point where your follicle just can't withstand the stress, and your follicle's kind of gotten big because it's full of all this cells and oil and bacteria, then what happens is it either leaks, it ruptures, or it blows out. So if it leaks and a little bit of material goes outside and there's an inflammatory process, you get like a papule or a pustule. If you get like a big rupture, bigger area open to the outside, more material, it's deeper, you're going to get a nodule or a mini cyst. If your whole follicle kind of opens up, you're going to get a big cyst. Now, the big cysts are the ones that typically scar. You can get scars, meaning a loss of tissue or depression. You can get scars from nodules, but cystic acne virtually always scars because the inflammation hits the dermis and it destroys collagen and elastin as it makes its way to the surface. So I don't know if you have had at this point, if you've actually had any depressions or any actually scars. You have some discoloration. But
I don't think I've had it. I've never had divots or anything.
That's fabulous because that's great. Okay, so very lucky there. So what we have to do is, number one, we have to introduce something in the follicle that keeps the cells from sticking together. We want to interrupt the process. Number two, we want to introduce something that's going to keep those colonies of P. acne bacteria at a level where they're not sitting there eating the oil and excreting this fatty acid byproduct. If we don't have, if the follicle doesn't rupture or leak or blow out, you don't have any lesions. So if we can keep that bacteria at a minimum, we can't kill it forever, but we can keep the colonies down if we do something on a consistent basis. And then we want to deal with the inflammation. Now, the agents that we use to address what I just talked about are the same things that even if you didn't have acne, some of them I would use to give you the appearance of much smaller pores and give you the appearance of skin that looks just the texture and everything. And what we all want, I mean, we all want to say, oh, gee, if I don't put any foundation on, if I don't wear any makeup, my skin still looks really good.
Yeah, yeah.
That's what we want. We
Yeah.
want complete clearing, and we want your skin to just look really nice and glowing, and that porcelain look. Okay, so that's what we're going to go for. Now, what I want to do is I want to make your program really simple. There are things that I can add to her program if we don't get to complete total clearing.
Okay.
But what I want to do initially is I want to do the things that I know typically are going to get you there. But then again, we can always add to that. Now, the other thing is that, Sydney, if you don't mind, you're 19. So generally, the average age that a female starts using like a product routine where you go out, maybe you don't necessarily have a skincare issue, but you say, oh, I'm going to start using, I'm going to start using Clinique, or I'm going to go into the drugstore and I'm going to get a cleanser and a toner and a whatever, is 25. So prior to that age, what we want to do is, the best thing we can do is, number one, we want to prevent sun damage, the aging kind of things you haven't seen yet, but most of what you're going to see in your lifetime is from cumulative exposure happened before the age of 10. At least 50% is programmed in your skin by the age of 20. It's going to take 10, 20 years to show up. So we want to prevent that. That's the best thing we can do. And then also, the common skin concern at this point in your life is acne. So we want to address that. It wouldn't do me any good to recommend a huge number of products that are anti-aging products.
Yeah.
Okay, so I'm going to keep it really simple for you. So here's what I'm going to do initially. And what I want you to know is, first of all, I'm going to continue to work with you. So we're going to be checking back with you like in about 4 days to see kind of and believe it or not, you can start to see a difference in 4 days. Just to make sure that we're doing everything correctly and that she's starting to see a result. And we'll continue to check back with you like in another couple of weeks and over time, because if we're not getting complete total clearing, there are things I'm going to add into your program, kind of a step at a time. Okay, but first of all, what I'm going to have you do is I'm going to have you use a benzoyl peroxide wash, which I do not have sitting here, but it's a BPO 2.5% wash. Now, let me tell you how benzoyl peroxide works. Benzoyl peroxide forces peroxide into your follicle, releases oxygen. The P. acne bacteria can't live in oxygen. And it kills it better than anything that we've ever seen. That's a statement by the American Academy of Dermatology. If it works for you once, it works for you forever. You can't develop resistance if it's at the right percentage, right formulation. So the starting point is going to be this wash. Now, the wash you wash off, so that's really not the big guns, but it's going to be helpful. The next thing that I'm going to have you do is I'm going to have you use something called Duality. Okay, this is Duality. Or no, I take that back. Erase. I'm not going to have you use Duality. I'm going to have you use benzoyl peroxide. And by the way, have you ever used benzoyl peroxide before?
I don't believe so.
Okay. I'm going to have you start off with benzoyl peroxide 5%. We make a 5%, we make a 10%. So I can always take you to another level. But lots of times I find that you start off with 5% at night, then increase it to 5% day and night. And many times that's as far as you need to go. If we need to go to 10%, we can. And there's one other thing that I want you to use. At this point, I'm going to have her use, actually 2 things. BioClear. BioClear is a combination of glycolic, salicylic, and azelaic acid. Azelaic acid is sold by prescription for acne. It's also a fantastic agent for resurfacing for the size of the follicles because it helps to get rid of that retentive matter, so your follicles kind of relax. But when you put those 3 acids together, the salicylic and the glycolic, it just is incredible for getting in there and helping to prevent those cells from sticking together. And it also resurfaces the skin. So again, your skin just looks a lot smoother, and it can help to get rid of that discoloration a bit faster. And finally, I'm going to have you use our SPF 33. Now, the SPF 33, I think you're really going to like this. So This sunscreen has an oil capture system in it that has an almost unlimited capacity to absorb oil, but it can't absorb the actives. In any place where you tend to be dry, it makes you feel soft and silky. You're oily, it makes you feel really balanced. And it has some other kinds of things in it beyond the sunscreen that I think will really help, again, with the discoloration, the appearance of discoloration, and some of those things. So I think you're really gonna like this product. Again, there are things that I'm probably going to maybe work into your program at some point.
Okay.
For example, you say you like once in a while doing this mask from Lush.
Mm-hmm.
Well, I might actually work into your program at some point something called a proteolytic enzyme. It's Cleanzyme and Skinzyme. So Cleanzyme and Skinzyme, it's a green papaya, green unripe papaya. It's about 50 to 100 times stronger than ripe papaya. And what it does, it digests dead or diseased tissue, but it can't hurt normal living tissue. So you put it, it's a mask, a cleanser in a mask, put it on. When you take it off after 10 minutes, it's like your skin looks like glass. So, and it makes your pores look smaller. And it just kind of enhances that whole thing with what we're trying to do is to keep the skin looking just really, really clear. And I have a few other things up my sleeve as well. So again, what I'm emphasizing here is that I'm going to continue to work with her and really continue to fine tune her program and to make sure we get to that point of complete total clearing. You have any questions for me?
Oh, I think you answered them all, yeah.
You really? Okay. Oh, then good job. Well, thank you. And I want to, again, encourage you to please subscribe to the channel. And I really appreciate you tuning in and watching. See you later. Bye.